Hello, my name is Josette, and today Paulina and I will be talking to you guys about a very important topic, health inequities. But before we dive into the subject, I want to explain to you guys the difference between health disparities and health inequities. So according to the CDC, health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. So, for example, women are more likely to have chronic conditions rather than men. So, health disparities can be based on your gender, race, ethnicity, income, or your living conditions. One example of racial inequity is among sickle cell patients, and in the United States, there are about 100,000 patients who suffer from sickle cell disease. And this disease causes red blood cells to become misshapen or broken down, which impairs its function to carry oxygen throughout the blood. And according to a podcast posted by NPR, sickle cell patients have to wait up to 50% longer in the emergency department than other pain patients. Not only that, but there's also a lack of government funding for sickle cell patients. Lastly, Elliot Vichinsky, a doctor who works at UCSF's Benioff's Children's Hospital in Oakland, California, says, "There is no question in mind that class and color are major factors in impairing their survival, without question."
Why are health inequities a problem? Most experts agree that healthcare contributes to only 10 to 15% to health outcomes and lifespan. Where you live is a bigger determinant of your health. For example, in the Bay Area, people who live in West Oakland can expect to live on average 10 years less than those who live in the Berkeley Hills. People who live in San Francisco's Bayview or Hunters Point can expect to live on average 14 years less than the people who live on Russian Hill. People who live in Bay Point, West Pittsburgh, can expect to live on average 11 years less than the people who live in Orinda. For health inequities, the more advantaged live longer and healthier lives from birth to old age. It affects newborn health problems like premature birth, low weight birth, birth defects. It can lead to signs of future disease such as high blood pressure, obesity, and weak immune systems. Chronic diseases like diabetes, heart disease, and many forms of cancers are also examples of health inequities. Now you may ask, what are factors to this problem? Many times the environment plays a big role. In poor neighborhoods, schools perform at a poor level and dropout rates are high. Additionally, access to transportation, quality affordable housing, decent parks, recreational opportunities, quality grocery stores are also often very limited. Poor neighborhoods also tend to be in closer proximity to sources of environmental pollution. The United States is considered one of the richest countries in the world, but Americans have one of the shortest life expectancies of any industrialized nation. For health, the United States ranks behind more than 20 other countries. And in the US, we spend more per capita on healthcare than any other nation. According to the World Bank, in 2013, globally, 767 million people were living on less than $1.90 a day. Half of them were under the age of 18. In 2016, more than 6 million children in the US, 1 in 12, lived in extreme poverty, which was less than $34 a day.
So, what's being done to address this problem in the United States? Honestly, absolutely nothing. The state and federal government have taken no action to address this issue, which means that this problem will never be recognized nationally.
Now you ask, what should be done? Since other factors play a huge role in health inequities, our nation must address those underlying factors and not only focus on treating symptoms. These underlying factors must be considered when health policies are created. We must also build up social, political, and economic power in low-income communities of color. This allows communities to directly attack institutionalized racism and create a policy change for their communities.